Today we're going to talk about a very important topic, addiction. Specifically, we'll focus on two powerful drugs, heroin and methamphetamine. A 2017 research article breaks down the addiction process for these drugs into 4 stages. It's crucial to understand how these substances can hijack your brain before you even realize what's happening. Hi, I'm Dr. Pierre. I am a board-certified anesthesiologist and an addiction medicine specialist. I have extensive experience in the operating room and in both methadone and Suboxone clinics. I've dedicated my career to helping patients overcome the challenges of addiction and thrive with recovery. I also provide hormone replacement therapy, working closely with individuals to restore balance, nutrition, and improve their overall well-being. While this podcast is designed to share valuable information, it's important to consult your doctor for personalized medical advice that fits your unique health needs. We have an emerging problem. The FDA is no longer listing semaglutide and tirzepatide as currently in shortage. This means that thousands of people receiving these compounded drugs may soon lose access or have to pay over $1,000 per month to continue treatment. What will people do? Well, I've been preparing my patients for this day with other alternatives that, when combined, can be very effective in maintaining optimal weight. Let me briefly start with the first one, called berberine. Let's start with the first stage of addiction, experimentation. This is usually the initial try, often driven by curiosity or peer pressure. Interestingly, the study found different motivations for people trying heroin versus meth. While both share common factors like curiosity, those who experiment with meth often do so to self-medicate. They might use it to cope with emotional issues, social anxieties, or even to lose weight. The second stage is occasional use. This is where someone starts using the drug more regularly, though not necessarily daily. Even at this stage, powerful cravings can develop, creating a mental dependence on the drug. Both heroin and meth can start rewiring your brain's reward system, making you crave more even before you realize you're losing control. The third stage is regular use, where drug use becomes a daily habit. The transition from occasional to regular use can be alarmingly fast for both heroin and meth. This rapid progression highlights the importance of prevention and early intervention. The final stage is compulsive use. At this point, addiction has completely taken over. The user continues despite devastating consequences to their health, relationships, and overall life. Their whole world revolves around getting and using the drug. It's important to note some key differences between heroin and meth. Meth has an alarmingly rapid addiction potential. Even a single dose of meth can induce long-lasting changes in the brain's reward system. This is why it's crucial to understand that even one-time use can be extremely dangerous. Now let's talk about how these drugs affect your brain. Heroin is an opioid that attaches to receptors controlling pleasure and pain. It overwhelms your brain's natural reward system, leading to tolerance and physical dependence. Meth, on the other hand, is a stimulant that floods your brain with feel-good chemicals and triggers a fight-or-flight response. Both drugs ultimately hijack your brain's reward system, creating a dangerous cycle of dependence. The physical toll of these drugs is severe. Heroin use can lead to fatal overdoses, especially with the rise of fentanyl-laced heroin. Long-term use can cause collapsed veins, heart infections, and liver damage. Meth can cause severe dental problems, heart damage, lung issues, and even brain damage affecting memory and cognitive function. Mixing heroin and meth is incredibly dangerous. The effects are unpredictable and can easily lead to overdose. The combined damage to your heart, brain, and other organs can be devastating. Despite the grim reality of addiction, recovery is possible. It starts with admitting there's a problem and reaching out for help. Treatment often begins with medically supervised detox, followed by therapy to address underlying causes and develop coping skills. Medications can also play a role in managing cravings and preventing relapse. Family and friends play a crucial role in supporting recovery. Expressing love and concern without judgment, encouraging treatment, and setting healthy boundaries are all important. To prevent relapse, having a strong support system is vital. Developing healthy coping mechanisms and avoiding triggers are also key strategies. The key to success is having open and honest conversations with your healthcare provider. Ask questions, share your concerns, and take an active role in your care. This podcast does not replace an evaluation by a knowledgeable health provider. So please see a healthcare provider before making any healthcare decisions based on this podcast. If you choose to have that conversation with me and you live in Oklahoma, Texas, South Carolina, or Florida, I'm here to support you directly with personalized care and expertise. If you're ready to take the next step, don't hesitate to reach out to me, my staff, or any qualified healthcare provider. Thanks for listening.